Good morning, everyone. Oh, man. Uh-oh. Yeah. All right, we'll try this one more time. Good morning, everyone. Much better. All right, welcome to the CMS 2017 PACE Conference and Webcast. My name is Stacy Plizga, and I, along with my colleague,
Kay Rabel,
will be co-moderating the conference today. So you'll see one of the two of us throughout the day. So we are excited to have all of you here with us, and we're going to go ahead and get started. This morning we are gathered here in the CMS Central Office Auditorium in Baltimore, where the conference is originating from. And we have a number of CMS experts and subject matter experts and sponsors who will provide new information to PACE organizations and industry stakeholders. Throughout the day, CMS experts are going to share information on many topics, including the audit process, emergency preparedness, PACE plan requirements for Medicare Part D payment policy, and operational guidance and program agreements. We would like to recognize all of our participants today, both those in-house and also our webcast members. We have over 1,100 people joining us today, so welcome to everyone. Before we get started, I just wanted to go over some logistical items with you that may be helpful throughout the day. First off, webcast materials are available at the CTEO website that is listed on the screen. If you have not done so already, please go to that website and you can download the materials to follow along with our presenters. If you are having technical difficulties, we have staff members who are available to assist you. Please use the email box CTEO techsupport@cms.hhs.gov for your technical questions or concerns. And for our webcast viewers, please remember that using an Ethernet connection instead of Wi-Fi and Google Chrome instead of Internet Explorer may increase the webcast streaming speed and prevent delays. The PACE conference and webcast will feature interactive polling during the sessions and for end-of-session evaluations today to allow both our in-house guests and our webcast viewers to participate. There are a number of ways that you can participate. You can respond to polling questions either from a mobile phone, or you can respond from any smartphone, computer, iPad, or tablet by using the web browser. Okay, so we would like to encourage everyone, both in-house and webcast, to participate in the polling today. And if you would like to do so, we're going to go through the instructions. So if you would like to connect either via your phone or via your computer or tablet, we're going to start off with the instructions for text message voting. So if you would like to vote, the first thing that you have to do is you have to join my session. So to join via text messaging, take out your phone and select your text message screen. You're going to create a new message and type 22333 into the to or recipient box. Next, you're going to type CMS 2017 PACE into the message box. This is not case sensitive. However, please do not put any spaces in there. No spaces. Then go ahead and send your message. You should get a message back that says you have joined the CMS 2017 PACE session. If you got a message back that didn't say that, said a different session, you are in the wrong session and you want to start over. Okay, so you are now logged into the session. You will stay logged in for the entire day, so you only had to do that once. You can only submit answers to questions when the moderator or speaker prompts you to do so. To enter your response using your cell phone, you will simply enter your response each time a poll is conducted by typing in the letter that corresponds with your answer, and then you hit send, and that's all you have to do. Okay, we also have end of session evaluation questions. So this is a little different than just responding to a question, so I'm going to go through this with you, and then we will go through it again with you when it is time to evaluate a session. But first off, when you are prompted by the moderator, you will answer A to the question, I would like to respond to this session. When you do that, you're going to receive a text back that says, hello, please evaluate this session. And it gives you a link. You will want to then click on that link, and you will be taken to the Poll Everywhere site. You are going to choose Start, and then you will be presented with 4 different questions. When you answer the first question, you will then click Next. And then it'll take you to the second question, then you click Next all the way until the end, and then you click Finish, and then your answers are submitted at that time. Okay, if you would like to join via the web browser, so if you're joining via your smartphone or computer or tablet, any of the above, you will want to go to www.pollev.com/CMS 2017 PACE. Again, no spaces. And then you should receive a screen back that says, please stand by. The poll is not in session, and that is exactly what you want to see. The polling questions will appear, however, when they are activated. Entering your response via the web browser. Once a poll is activated, responding is very easy. When a polling question appears, you're going to simply click on your answer and click Submit, and that will submit your answer. Responding to end of session evaluation questions, we'll go through these instructions for our web browser audience also. When prompted by the moderator, you will see a polling question that comes up, and you want to respond yes to, I would like to evaluate this session. You will be presented with a link, like the one that is on the screen. You're going to click on this, the link that is in the green box. That appears very quickly, so you have to be quick, and you have to click on that, and it will take you to the series of questions that you are going to answer. The next screen will appear, and then you click Start Survey. And then you will select your answer that corresponds to the question and click Next until you finish all 4 questions, and then you will click Finish to submit your answers. We're going to go ahead and give this polling a try. So remember, you either needed to connect via your cell phone and texting or via the web. And our question is, coming up very slowly, which emoji best represents your morning? So go ahead and make your selection A, B, C, or D, and we'll see how everyone is feeling this morning. And you'll notice as your responses are coming in, the bars on the graph are changing. So we'll give a minute for everybody's response to come in. It looks like the majority of us are pretty happy today, although there's a couple who look a little bit frazzled and surprised today. So hopefully by the end of the day, you'll be feeling a little bit better. We look forward to everyone's participation today, whether you're one of our in-house guests or one of our virtual participants. For our webcast participants, if you have a question that is related to the presentation at any point today, you can go to the CTEO website And there is a SurveyMonkey link there that you can ask CMS questions live. You can go ahead and click on that link and enter your questions at any point, and we will address those today throughout the conference. For our in-house participants, we do have a microphone set up in the center of the aisle. If you have a question, we ask that you step up to that microphone, and when you do, tell us your name and where you're from, and we do ask that your questions are all presented at the microphone so that everyone, both in-house and our viewing audience, can hear your question. If you have a technical question about polling at any point during this event, you can send an email to tklagholtz@providerresources.com. And if you have a technical question regarding the conference or webcast, you can send an email to CTEO techsupport@cms.hhs.gov. All right, well, that is it for me today. We have an agenda that is packed with subject matter experts, and we are very excited to go ahead and get started today. So I would like to introduce to you our keynote speaker today, who will be kicking things off for us, Martha Hennessy.
Thanks, Stacy. Good morning, everyone. Thanks to all the PACE organizations and states for taking the time to either be here in person or join us through the webcast for our second National PACE Conference. We find these forums and all our opportunities to interact with the PACE community to be incredibly valuable, as it provides a chance to directly interact and share our collective efforts and activities. This is critical to ensuring a PACE program that remains strong and successful, and one that best meets the needs of our most vulnerable beneficiaries. Last year's conference and recent CMS presentations at conferences sponsored by other organizations have focused on several initiatives intended to strengthen and improve the PACE program. I would like to briefly address these initiatives. First, as most of you are aware, we have been working to revise the proposed PACE regulation in response to the public comments we received. We look forward to releasing a final rule in the near future. With respect to PACE quality, CMS continues to coordinate and align the PACE quality measures with CMS's global vision for quality management across all programs. CMS's goal is to identify those measures that are most meaningful to the PACE program and its participants without placing unnecessary burden on PACE organizations. As many of you may know, the CMS Medicare Medicaid Coordination Office is exploring a potential model test under the PACE Innovation Act. In response to a request for information we released this past December, we received 75 comment letters, including those from PACE organizations. We received helpful comments on a potential PACE-like model for individuals duly eligible for Medicare and Medicaid, age 21 and older, with disabilities that impair their mobility, who are assessed as requiring a nursing home level of care, and meet other eligibility criteria. We are referring to this model as a person-centered community care, or P3C. We also received feedback from PACE organizations and others that we should implement a model test that would focus on elderly individuals, especially Medicare-only individuals, who are at risk for needing nursing home care, but who do not meet state nursing home level of care criteria. We are also exploring the potential for a model test focused on this population. What we would like you to know about these initiatives is that the public comments we received in response to our request for information are posted on our website and available for public review. We also expect to shortly post to our website data on potential adjustment to Medicare payment rates under a demonstration. And I know many of you are particularly interested in this potential model test. At this time, we're considering various options, so please stay tuned. As you know, we recently automated our application process, which has dramatically reduced the level of burden required for both initial and service area expansion applicants. This process is now largely attestation-based, resulting in much less narrative requirements. For those of you who have experienced the automated application process, we believe you would agree that the process has been dramatically streamlined. The quarterly submission cycles provide a much more efficient approach and allows for workload planning and what we hope will result in a more organized and improved process for all parties involved as we continue to refine the application process. For this year's conference, the theme is strengthening the foundation of PACE. Many of today's agenda items focus on PACE program updates. We will also highlight requirements of PACE organizations that came out of the recent final rules specific to emergency preparedness expectations. Other agenda items, such as formulary issues and coordination of benefits, will provide information intended to enhance your understanding of current regulatory requirements associated with the PACE program. And later today, you will also hear about our efforts to streamline the process for amending PACE program agreements. The program agreement is critical as it memorializes key components of the PACE program and represents the binding contract between CMS, the PACE organization, and the state administering agency. Some of you have already or are currently working with us, as well as your state counterparts, to update the program agreements as updates to appendices trigger changes to the existing agreements. In the future, we hope to address this as a comprehensive effort, perhaps through automation, but you'll have to stay tuned for our efforts with that. This is critical as we have a significant number of PACE programs that have been active for some time and likely require some updating of their program agreement contents. I would now like to take a moment to recognize and briefly address the critical role of states as part of the PACE program and undertakings specific to the state administering agencies. As you know, the state plays a necessary and vital role in the application process. As we begin to gain experience with the automated PACE application process, we are working to ensure an efficient flow of communication between the applicant, the state, and CMS. For example, the initial application requires an upload from the state that ensures a willingness to enter into a PACE program agreement with the entity, and that the state considers the entity to be qualified to be a PACE provider. There are also various other documents the state provides as part of an initial application. We have heard from some states that there is some inconsistency in communications related to the request for additional information and subsequent follow-ups with CMS. Therefore, we are working on ways to ensure timely and consistent state communications related to the request and applicant responses to ensure that the states are appropriately involved throughout the application process. Now, states' access to HPMS. As CMS moves to automate more PACE operational activities via HPMS, we are taking steps to ensure that the states have the access and knowledge that they need to access a PACE organization's information in HPMS. This is critical as part of the state's oversight and monitoring of its PACE program. In closing, I would like to emphasize that our goal is to improve the operational aspects of the PACE programs with all parties working together. I would note that we continue to receive very thoughtful questions to our DMAO portal. These inquiries are essential as they allow us to think about the aspects of the program that may require additional operational or policy consideration. So please continue to use the portal. We appreciate your feedback as we work together to refine and improve the PACE program. We have a strong mutual interest in seeing the PACE program grow stronger and continue to offer Medicare and Medicaid individuals an important option for receiving high-quality care. So thank you for participating in today's conference, and we're excited to get started. So I will turn this back over to Stacy, who will introduce the first session. Thank you all.
Okay, thank you, Martha, for the kickoff and the introduction into the PACE event. Our first session today consists of a panel of speakers who will highlight changes to the audit process for 2017 PACE audits and what PACE organizations can expect during a CMS audit. Updates and an overview to the audit process will be discussed by Caroline Zeman, Daniel Dice-Roth, Anne-Marie Anderson, and Lisa Dubois. Please help me welcome them.
Good morning, and again, welcome to the conference. We're going to begin with some introductions again. My name is Anne-Marie Anderson, and I'm with the Philadelphia Regional Office.
I'm Lisa Dubois from the Denver Regional Office.
I'm Dan Dice-Roth with the Philadelphia Regional Office.
And my name is Caroline Zeman. I'm with the Medicare Oversight and Enforcement Group in Central Office.
Today, we're going to be talking about the 2017 PACE audit process. During today's presentation, we'll provide a high-level overview of the 2017 audit process from the beginning of the process through to the end. One of our primary objectives is to assist PACE organizations in preparing for a successful audit. As we go through each phase of the audit, we'll be talking about ways that PACE organizations can prepare and some helpful hints to make the process a little easier for you. Once we've finished reviewing the audit process, we'll discuss some of the common conditions cited as a result of the 2017 process. Sorry, and finally, we'll open the floor for discussion. Thanks, Dan. Before we begin our presentation, we want to take an opportunity to remind everyone that the new audit process does not change the regulatory requirements that PACE organizations are expected to follow. The regulations and requirements PACE organizations are expected to adhere to remain the same as in past years. However, redesigning our process, in 2017, we took a different approach on how we are assessing compliance with those regulations. Excuse me again. We are more focused on the participant data, collecting universes, and analyzing the PACE organization. As a result, our audits this year may uncover conditions of noncompliance that have not been previously cited. Did you switch over? Okay. The audit protocol used in 2016 and in previous years include reviews of many 20 elements. I'm sorry. I just need to take a sip of water. Thank you. Sorry about that. In 2017, CMS will be reviewing 5 elements in each audit: service delivery request, appeals and grievances, which we refer to as SDAG, clinical appropriateness and care planning, personnel, on-site, and quality. A detailed description of these 5 elements, including sample sizes and documentation needed to review the element, and the compliance standards being evaluated, can be found in the 2017 audit process. For those organizations who have received an engagement letter, the audit process data request is attachment 1 and can be downloaded from HPMS. Good. Okay, give me 1 second. I'm sorry, my page has got a little messed up here. Give me Dan's notes. I'm sorry, my page has got a little out of order, so instead of delaying, I'm just going to steal Dan's. The pre-audit process begins with the issuance of the audit engagement letter. The audit engagement letter is issued via HPMS 60 days prior to the start date of the on-site audit and contains important information related to the submission and pre-audit documentation in universe submissions. The audit engagement letter is issued to the CEO listed in HPMS. A copy of the engagement letter will also be sent to the program director by the audit lead via email The CEO must attest to the receipt of the audit engagement letters within 2 business days from the date the letter is issued. For this reason, it is important to make sure that your CEO has an active CMS user ID. If your CEO does not currently have a user ID or HPM access, one can be downloaded and submitted using the application for access to computer systems, which can be found on the CMS website. CEOs with inactive user IDs or have forgotten their password should contact the HPMS help desk using the email hpms_access@cms.hhs.gov. In the event that your CEO is unable to attest within 2 business days, a staff member with attestation rights can assist in attesting to the engagement letter. The audit engagement letter lists 4 attachments. The attachments are available in HPMS and are available in the submission materials section of the audit module. Attachment 1 is the audit process and data request. Attachment 2 is the supplemental questions document and contains 9 questions that require PACE organization's response. Attachment 3, Attachment 3 is the pre-audit issue summary. The pre-audit issue summary is a list of all disclosed issues of noncompliance that occurred during the audit review period. This list should only include issues of noncompliance that were disclosed to CMS prior to the audit engagement letter. PACE organizations do not need to include all issues, just those that are relevant to the areas being audited. Level 1 and Level 2 data that has already been reported to CMS should be excluded. PACE organizations must provide a description of each issue, as well as the remediation status, what was corrected and when. Using the pre-audit issues template, the PACE organization's account manager will review the summary for accuracy and completeness. CMS will consider issues corrected if the PACE organization can demonstrate that correction or remediation was implemented prior to the letter being sent. Attachment 2 and 3 are due within 5 business days from the date the audit engagement letter was issued. Attachment 4 is a zip file of the impact analysis templates, but those are there only as an FYI. If your auditor requires an impact analysis, they will submit one into HPMS and let you know that it is there. So let's go over some frequently asked questions, some frequent questions about the attestations. Good. My CEO does not have HPMS access. Who can attest to the audit engagement letter? While we encourage your CEO to make sure that they have an active user ID or password, if they are unable to attest, another user with attestation rights at your organization can attest. In order to find out who has attestation rights, you can contact the CMS help desk. The next question, what does CMS consider a self-disclosed issue? For an issue to be included as self-disclosed issues during the audit, several factors must be met. The issue must be within the scope of the audit, and the issue must have been disclosed to CMS prior to receiving the engagement letter. Okay, the pre-audit universe submissions. In previous years, PACE organizations submitted participant and personnel universes. As we discussed earlier, CMS is emphasizing a data-driven and participant-centered approach in 2017, and as a result, PACE organizations are now required to submit universes for service delivery requests, appeals, grievances, participant medical records, personnel, quality, and on-call. The data requirement for each universe are detailed in the audit process and data request document. In order to assist PACE organizations, CMS has developed templates for each audit universe. The templates are available to all PACE organizations, and the use of the templates is completely voluntary. Templates come with instructions and can be used to to identify data entry issues in the universe. These templates can be built so that the PACE organization can validate their own data before submission to CMS. We have found that the PACE organizations that utilize the templates in the submission materials folder are less likely to have to resubmit data than organizations that do not utilize them. All universes must be completed and uploaded into HPMS no later than 30 days from the date the audit engagement letter is issued. If the universe contains data entry errors, your audit lead will request a resubmitted universe. So we're going to go over some suggestions on how to avoid that resubmitted universe. I'm sorry, my allergies are killing me. Of course, they were fine all morning, but as I get up here, they start bothering me. So when you're entering a date, when you enter a date, you want to be careful to do the 4-digit year, 2-digit month, 2-digit date. So you wanted 2017-07-20, today's date. Do not enter more than one date in any field except the service request assessments. When answering yes or no to a question, you want to just put Y or N, not Y in quotations, Y space. That will cause a data entry issue. And for non-applicable, it's just NA. No N space A, N/A, just NA. And do not leave any blank spaces. Blank spaces will cause a data entry issue as well. And now I'm going to turn it over to Lisa, who's going to give some tips on actually populating the universes.
Thank you, Anne-Marie. So the first universe that we'll give you a few tips on is the service delivery request universe. And we ask you to include all requests that you process as service requests under 42 CFR 460.104 D2. Include requests that are based on decision or the process date. The date the request was initiated may fall outside of the review period. We want you to enter the date received as the date you deemed the request received in accordance with your internal policies and procedures. And please include all months in the universe in one tab. The next universe is the appeals records universe. Again, include all requests that are processed as internal appeals only under 42 CFR 460.122, and exclude external appeals, which are the Medicare and Medicaid appeals. And for standard appeals, organizations do not need to enter the time. They may enter NA in that column. And again, please use all months should be included in one tab in the universe. For the grievance records universe, include all requests that are processed as internal grievances under 42 CFR 460.120. So notification allows for oral and written. Organizations should enter the only ones that are applicable to them. So if you notify participants in writing only, then you would enter NA in the oral notification field. The personnel records universe, you want to include all personnel that are employed during the audit review period, including all newly hired personnel, any personnel that were terminated during the audit period, and all contractors that you use. The LOPMR, or the list of participant medical records, please include all participants that are enrolled at any point during the audit review period. If a participant has received both skilled and unskilled care, always indicate the higher level of care, i.e. skilled. And for the other fields in this universe, we want you to fill these fields out based on how you define these terms. For example, psychoactive medications, how you define a functional decline, hearing and vision loss, and how you define significant weight loss. Again, if you have questions when you're filling out the universes, please submit those questions to your audit lead or the PACE Audit Queues mailbox. The Quality Assessment Initiatives records, please include all quality initiatives that occurred during the audit review period, that 1-year period. And then just a couple of tips regarding the on-call universe that you submit. Include all on-call after hours that are received by the PACE organization, and exclude calls that you receive during normal business hours. So a couple of frequently asked questions. Does my organization need to wait until we receive the audit engagement letter to begin preparing audit universes? No, please don't wait. PACE organizations can and should begin preparing universes at any time. You're expected to submit data as required, so we highly encourage PACE organizations to begin populating your universes now and not waiting until you receive the audit engagement letter. This will help to ensure data accuracy. Next question is, what is the audit period or the time frames for the universes? And that audit period, again, is 1 year preceding the date of the issuance of the audit engagement letter. So a few notes about the preparing pre-audit. During the audit, CMS and the state agency administrators will review documentation and conduct observations to determine compliance with the regulatory requirements. Ensuring documentation is available at the beginning of the audit will help avoid delays in the audit process. The documentation that auditors will be reviewing to determine compliance is detailed in the audit process and data request documentation. We highly recommend that you review the required documentation prior to the audit in order to ensure that you have all documentation present. One of the best ways to avoid delays during the audit process is to ensure that auditors have access to medical record systems prior to the time when we arrive on site. If you have more than one medical record system, such as a separate pharmacy system, for example, CMS will need access to each of those systems. In some instances, auditors may conduct desk reviews. If the audit team will be conducting a part of the audit as a desk review, the audit lead will contact you and let you know what documentation should be uploaded to HPMS and when the desk audit will begin. In 2017, the audit protocol, auditors will submit sample requests to each PACE organization 1 business day prior to the start of the review of that element. In some cases, participants chosen for observation may be unavailable, and if this is the case, the audit team will work with the PACE organization during the on-site audit to replace participants that were selected. Auditors may also decide in some cases to replace medical record samples while they are on site. And if a change is made to the sample selection for any element, the audit team will make sure that your organization is aware. So now I will turn the presentation over to Dan, and he will discuss the actual audit portion of the process.
Thank you, Lisa. So as Lisa just mentioned, with the exception of participant observations, CMS may conduct some of the 2017 audits as a desk review. Desk reviews can be achieved by either remote medical record access, documentation uploads to HPMS, and also webinars. If an audit team plans to conduct one or more elements as a desk review, the audit lead will contact the PACE organization to determine if a desk review is possible. Desk reviews may begin before the on-site audit, or they may be conducted concurrent with the on-site audit. In large part, the The on-site audit will be a familiar experience for those PACE organizations who have previously been audited. Auditors will conduct reviews of medical records, service delivery requests, appeals, grievances, and personnel records. Auditors will also conduct between 3 and 5 participant observations, an inspection of emergency medications and equipment, and an inspection of vehicles, and an interview with personnel involved in your organization's quality assessment and performance improvement program. In order to assist auditors and help PACE organizations determine the cause and scope of issues identified during the audit process, we request root cause analyses and impact analyses. When an auditor suspects that an issue may result in a condition of noncompliance, they will request that the PACE organization complete a root cause analysis. The completion of the root cause analyses provide PACE organizations and auditors an opportunity to determine how and why conditions of noncompliance occurred. Determining why conditions of noncompliance occurred is essential to understanding the noncompliance and ensuring effective corrective action. When root cause analyses are requested, the auditor will upload a partially completed template to HPMS. The auditor completes the first portion of the root cause analysis by indicating the date that the issue was identified, a description of the issue, and condition language associated with that particular issue. The PACE organization then has 24 hours to complete the root cause analysis and upload the completed document to HPMS. When completing root cause analyses, PACE organizations are asked to identify the root cause of the issue, the number of impacted individuals, the methodology used to determine the number of affected individuals, actions taken to resolve the issue, and actions taken to resolve negatively impacted participants. In order to identify the root cause, PACE organizations must understand the issue. If a problem or issue is unclear, please discuss the request with your audit lead before completing the root cause analysis. If you do not know the number of impacted individuals, it is completely acceptable at this stage to respond that the number is unknown. Likewise, if corrective actions have not begun, it's completely acceptable to state that they have not yet begun. Impact analyses are used to determine the scope and effect of conditions of noncompliance. Auditors are able to customize these analyses to obtain the information necessary to determine the scope and effect of the particular condition. For this reason, each impact analysis may look slightly different. PACE organizations have 10 business days to complete impact analyses. As with root cause analyses, PACE organizations are encouraged to speak with their audit lead prior to completing impact analyses if you have any questions whatsoever regarding the condition of noncompliance, or if the information being requested is not clear. The impact analysis is where the PACE organization would be expected to identify the number of participants that were affected by the noncompliance. Both root cause analyses and impact analyses may be requested before, during, or after the on-site portion of the audit. Auditors may also request the resubmission of both root cause analyses and impact analyses if the information provided is not accurate or adequate. Here are some things to keep in mind when completing root cause analyses and impact analyses. So as I mentioned before, you want to understand the issue. If you're not sure what the question is or what the problem is that's been identified by the audit team, you definitely want to clear that up with the audit team before completing the root cause analysis or impact analysis. Because what will happen is, in most instances, if it's not clear and you complete the document, we may have to ask for a resubmission if you're not addressing the issue that the audit team was referring to. You also want to ask any questions of the team before completing the document. So if they've submitted the root cause analysis, and whether the audit team is on site or whether they're off site, you can contact the audit team, contact the audit lead to clarify any of your questions. When you're looking at the root cause and developing the root cause, you want to address it very directly and clearly and objectively. So we want to get to the heart of the issue and determine why there was non-compliance. With the impact analyses, they are limited to the audit period. So as we mentioned in some previous slides, the audit period is 1 year from the date that 1 year preceding the date that the audit engagement letter is issued. So keep in mind that that audit period will apply to impact analyses. When you're completing an impact analysis, please be sure to complete all requested fields. And keep in mind that although you have 24 hours to complete a root cause analysis and 10 business days to complete an impact analysis, if you're able to complete those sooner, by all means, we would accept that being submitted sooner. All right, we're now going to move into the post-audit process. During the next few slides, we'll go into more detail on what happens following the on-site portion of the audit. Specifically, we'll cover information on the exit conference, additional documentation requests you may receive once the audit team concludes their on-site review, a brief overview of the PACT process, as well as how CMS may communicate conditions that changed following the PACT discussion. We will also go over the ICAR process that is new for 2017, the draft audit report process, the PACE organization's opportunity to comment or respond to the draft audit report, the final audit report process, and also the corrective action process. So first, following the on-site audit, the audit team will hold an exit conference with the PACE organization. This exit conference usually occurs on the last day of the on-site review. The exit conference is part of CMS's efforts to be as transparent as possible in this new audit process. As part of the transparency, we will hold an exit conference with all PACE organizations to go over all potential conditions of noncompliance. I want to highlight at the point of the exit, conditions are only potential. They are not final. A condition will not be considered final until the final audit report has been sent to the PACE organization. Additionally, we will use the exit conference to highlight outstanding documentation requests. For example, if the team is waiting on a root cause analysis or impact analysis. We will brief the PACE organization on the next steps of the audit process, and then we will answer any questions that your organization may have. However, keep in mind, CMS will not discuss classifications of audit findings at the exit conference. The classification of findings, such as whether it will be an ICAR or immediate corrective action required, CAR, corrective action required, or observation, are done at the PACT level for every audit. We want to remind PACE organizations that the audit process is not over when the exit conference happens. Auditors will still actively be working on the audit and ensuring that requested documentation is uploaded and reviewed. Additionally, new requests may be made following the on-site portion of the audit. And they will be made if auditors determine that a root cause analysis or impact analysis that they didn't originally think was needed may be needed. Any new requests will be made on the official document request log and will be uploaded to HPMS. Your audit team will also clearly identify due dates for the deliverable items. And now I'm going to turn the presentation over to Caroline.
So we're going to move to what happens following the exit. Behind the scenes, auditors will be working to finalize our internal audit papers and prepare final documentation. These final stages include preparing for and presenting conditions to the PACE Audit Consistency Team, or PACT. The PACT will hear all potential conditions of noncompliance and will make the final determinations on classification. For example, will the condition be cited as a CAR, ICAR, or observation, as well as making the decision whether to add or remove conditions. As part of the PAC process to ensure consistency, the PAC may decide to add or remove conditions when discussing the audit with the audit team. This is done to ensure all PACE organizations are treated the same way. For example, if the PAC notes that the PACE organization has a condition for untimely service delivery requests, the PACT may ask the audit team if there was evidence that those untimely requests were automatically processed as appeals. If there wasn't evidence, the PAC would add a condition related to failing to auto-process appeals. Likewise, if a potential condition is brought to the PACT that the PAC determines is not appropriate to cite, for example, the PACE organization's practice meets CMS expectations, the PAC may remove the condition from the audit report. We are committed to maintaining transparency in the PACE audit process. And as a part of that transparency, we believe that organizations should not be surprised when they receive the draft audit report. This entails presenting potential conditions of noncompliance at the exit conference, as Dan mentioned. But that also means that if conditions change at the PAC meeting, we want auditors to tell the PACE organization prior to them receiving the draft audit report. Therefore, auditors are instructed to set up a call with the PACE organization to explain what conditions were either added or removed by the PACT and the rationale for adding and removing them. Please note that because conditions may change up until the final audit report, we do not expect PACE organizations to take corrective action unless specifically directed by CMS through either an official ICAR email or through the issuance of the final audit report. New in 2017 is the classification of an ICAR, or an immediate corrective action required. When a condition is classified by the PACT as an ICAR, it means that the PAC has determined that the condition or failure is severe enough that correction must begin immediately and cannot wait until the issuance of the final audit report. PACE organizations will receive notification of all ICARs via email following the PAC meeting, usually 3 to 4 weeks after the on-site portion of the audit. PACE organizations will have 3 business days to prepare and submit corrective action plans in response to the ICARs identified. The next step in the audit process is preparing and issuing the draft audit report. The draft audit report will be issued through HPMS, and it will include all conditions of noncompliance and give their classifications. This will include all CARs, ICARs, and observations, and they'll be laid out by element. The draft audit report will also explain the conditions. Each CAR or ICAR will identify the cause or reason for the failure, as well as the effect or scope of noncompliance. PACE organizations have a formal opportunity to respond to the draft audit report before it becomes final. PACE organizations will have 10 business days to respond to the draft report, and responses or comments can include agreeing or disagreeing with findings, how they were classified, or how they were written. For example, a PACE organization may agree with the finding, but they may feel the cause or effect statement should be written differently to reflect the issue and impact. Once CMS has reviewed and responded to all comments, they will issue the final audit report. The final audit report will include any revisions made in response to comments and will have the final conditions and classifications for the audit. At this point, findings will no longer be open for dispute. Along with the final audit report, the PACE organization will receive a copy of all of our responses to comments. The final audit report will also detail the PACE organization's audit score. New in 2017, PACE organizations will now be scored during the CMS audit. ICARs will be scored 2 points each, CARs will be scored 1 point, and observations receive 0 points. The lower the audit score, the better the PACE organization performed overall. Please note that scores in 2017 are informational. CMS will not be taking compliance actions based on audit scores. Rather, they can be used by your organization to assess your organization's overall compliance rate. Compliance actions will only be taken when there are egregious audit findings, similar to how we handle compliance actions in the past. Once the final audit report has been issued, the PACE organization will have 30 days to submit final corrective action plans, or CAPs. CAPs must be entered into HPMS for any CAR identified in the final audit report. As a reminder, ICAR CAPs will have already been submitted into HPMS. Observations do not require corrective action plans. CMS will review the CAPs and either accept or reject them. Once all CAPs are accepted, the audit will move into a monitoring phase to assure that corrective action is implemented effectively. Once that has been verified, the CAP will be released and the audit will be closed. Before moving into the next slides, I want to take a chance to make 2 quick comments. First, the numbers and statistics that I'm about to present have likely already changed since we are continually conducting new audits and citing new conditions. However, the next few slides will provide a general overview of conditions cited as of July 11th. Second, I want to remind PACE organizations that audits are not only CMS assessing an organization for compliance, but they are a learning opportunity for both PACE organizations as well as CMS. Under this new process, PACE organizations will be able to see where their organization may be struggling, as well as where they may be excelling. It will highlight areas that need improvement, as well as areas that may be causing confusion. I want to stress that audits are not only a learning opportunity for PACE organizations, but also for CMS. We are continually reviewing the data received, questions asked, comments received, and conditions noted to see what areas we can identify for potential improvements. Part of what our new audit process consists of is compiling data for our central office policymakers and SMEs. We are continually providing feedback regarding what regulations are causing confusion and what regulations PACE organizations are finding challenging and/or burdensome. We will be collecting and utilizing the data received during audits to help drive policy discussions around PACE requirements and potentially add insight to future updates or clarifications that may be made. Now I want to go over a brief overview of the audits that have been completed as of July 11th. CMS has finished the on-site portion of 36 audits, and so far 134 conditions have been cited. Of those conditions, 32 have been classified as observations, 69 have been classified as corrective action required, and 33 have been classified as immediate corrective action required. So far, 14 final audit reports have been issued. Looking at a further breakdown, as you can see, SDAG, or Service Delivery Requests, Appeals, and Grievances, is the area where the most conditions are being cited. This is not really surprising, as it is the first year that we've really audited this area as a standalone element, and the first time we have assessed compliance with some of the requirements associated with the element. Again, this year should be used as a learning opportunity for PACE organizations to understand CMS requirements, as well as CMS to understand where PACE organizations may be struggling. So far, we have cited 109 conditions in SDAG. Outside of SDAG, the next highest element is clinical appropriateness and care planning. We have cited 17 conditions in that area so far. In personnel, we have cited 3 conditions. In on-site, we have cited 1 condition. And in quality, we have cited 4 conditions. This shows us that PACE organizations overall are doing well with meeting personnel requirements and utilizing their QAPI programs. Unlike prior audit years, in 2017, we will be able to give PACE organizations specific details on the issues of noncompliance noted during our audits. For example, in years past, we might have been able to say that 30 PACE organizations had failures or not mets in appeals, but would not have been able to tell you what those failures consisted of without re-reviewing the audit reports. However, since we are using standardized conditions in 2017 that are regulation specific, we can pinpoint those areas that are causing PACE organizations the most trouble. As of July 11th, here are the most commonly cited conditions. PACE organizations did not conduct in-person assessments and/or reassessments as often as required. This is probably one of our broadest conditions, and as such, it has been cited the most in our audits. This condition may be cited under SDAG when a PACE organization fails to conduct an in-person assessment as a result of a service delivery request, but it also may be cited under clinical appropriateness and care planning when a PACE organization fails to conduct an in-person assessment following a change in condition or during a semi-annual or annual review. We will be assessing all of our conditions prior to 2018 audit year to determine whether or not we should get rid of conditions, modify them, or in this case, possibly break it out into multiple conditions to be more specific to the situation. The next 2 conditions that are cited with some frequency are related to PACE organizations' denial notifications for service delivery requests. We have seen that PACE organizations are not always including the specific reason for the denial and/or appeal rights when providing denial notification to participants or caregivers. The next 2 conditions relate to untimely service delivery requests. We have cited a condition for untimely service delivery requests 9 times so far in 2017. That condition is cited when a PACE organization fails to notify participants or representatives of a decision to approve or deny the request within 72 hours from the date received or within 8 days when an extension is taken. Related to that condition, we have also cited PACE organizations for not automatically processing appeals following an untimely service delivery request. You may wonder how we have cited that particular condition 11 times when we have only cited untimeliness 9 times. As the PACE audit protocol mentions, we have internal thresholds that we use for timeliness measures to help cite conditions and classify them appropriately. While the regulation contemplates 100% compliance with our requirements, for audit purposes, we have created what we believe are reasonable thresholds to determine when a condition should be cited for timeliness. However, even if a condition is not cited for timeliness of service delivery requests, if there are any cases that are untimely in the universe, auditors will assess those to see if they were automatically processed as an appeal. If they were not, a condition might be cited even if there was no condition for untimeliness of service delivery requests. The figures that I just went over, again, may change prior to the end of the audit year. And as a reminder, we will be issuing an annual report that will summarize the 2017 PACE audit year. And that report will include all of the final common conditions, as well as an overview of the 2017 audit process. So we're now going to open the floor for questions. We do want to remind everyone before taking questions that while we'll be glad to answer any general audit questions, we will not be able to respond to questions pertaining to individual audit or individual audit findings. Questions related to individual audits must be addressed through the audit lead or the PACE audit queues mailbox, which is on this slide. Additionally, while we will answer some questions that overlap policy and audit, any questions that relate purely to policy will be referred to the DMAO portal for response by central office SMEs. And with that, we'd like to open the floor for questions.
So if you have any questions, please make your way to the microphone, state your name and where you are from. And as a reminder to our webcast participants, you can also ask questions via our Ask CMS Questions Live, found on the CTEO website.
Good morning. My name is Cliff Bauer. I work at Florida PACE Centers down in Miami. A couple questions. Under personnel files, you mentioned checking employed persons. Then you mentioned contractors. Contractors aren't employed. So when you say contractors, can you give a better definition of contractors? Like we have some of our residents stay in assisted living facilities. We have a contract with that organization.
Right. We're looking for individual personnel who are contracted to perform duties on behalf of the PACE organization, because as the requirements for personnel are laid out in the regulation, both employees and contractors are required to adhere to those requirements. So in regards to the contractors that would fall under those requirements as individual contractors, that your organization would need to make sure satisfy the personnel requirements, we would look for those contractors to be included in the universe.
I think when we're talking about contracted employees, we're talking about contracted employees who work directly with the participants of the PACE organization or who work at the PACE organization. So for instance, you may contract with your physicians, your physical therapists, your drivers, your, I could probably go on and on and on, but if you contract with physicians, drivers, people who are providing services directly to participants at the center, we would expect them to have to meet the same requirements as those people who are as those staff who are employed directly by the PACE organization. Okay, so in other words, if I contract with 3 different home health agencies, provide home health services, so they would you might ask for some of the personnel files from those home health agencies. That's correct. Okay. Yes. The next question I had is, on this summary of audit findings to date, you mentioned I think you'd done completed 36 audits, but the last bullet point was that you had only have issued 14 final reports. The numbers that you cited, was that from the 36 or from the 14 final reports? It was from the 36.
Thank you.
Hi there. I'm Dick Singer. I'm a CMS employee, a PACE account manager out of Region 1 in Boston. We've done two of the 2017 audit protocols now, and I think there's a little confusion in terms of preparing the root cause analysis, in that there are data fields for impact analysis. So would it be fair to say that in the case where the impact is data-driven and is readily apparent on the basis of the universe compliance test, that the impact analysis would be, I guess, documented on that root cause analysis spreadsheet, and in cases where it's more narrative-driven, that would be the case where they would have to perform an impact analysis subsequent to preparing the root cause analysis. Is that clear? I guess, in other words, my question then is, there's some confusion, or my comment rather, some confusion based on the fact that in preparing the root cause analysis, it's also asking you for an impact analysis. So what distinction do we make between the impact analysis that's documented on that root cause analysis spreadsheet and another one that's performed subsequent to that?
Right. So there's several issues at play here. First, the root cause analysis is really looking to get at the cause. Now, there are times where a PACE organization can investigate the cause and easily identify the impact. For example, it may have impacted every participant because it was a failure that was just a misunderstanding of the regulation, in which case it may be easy for a PACE organization to identify the impact on the root cause. But as Dan mentioned, we give less time for a root cause, and there may be times where a PACE organization is not able to easily identify an impact. In those instances, as Dan mentioned, we would ask that the PACE organization not give us an impact, say that they don't know the impact at that time, and CMS would then assess whether or not we need to collect an impact analysis. That decision that CMS will make is based on several factors. One, was the PACE organization able to easily assess the impact? And two, can we assess the impact? Because we don't want to ask the PACE organization to do something that we can already do. So for example, we have a universe of service requests, and we run timeliness at a universe level. So therefore, we already know the impact of untimeliness because we have a full universe available to us. We won't ask a PACE organization to recreate the wheel and do an impact analysis, since we already have that data. However, if we don't have the data available to us, and the PACE organization will have to do some sort of review to determine the scope or impact, that would be when we then request the full impact analysis. Along with identifying the participants, we would likely have them go back and give us the overview of the impact and the corrective action in the root cause, as well as identifying the number of participants that were impacted by that.
Hi, Carrie Hayes-McElroy with Trinity Health. I had a different question, but I have a follow-up question to what you said, just to help clarify. If we have, with the impact analysis, if you're unable to identify the impact and you go back to the PACE organization, ask them to do a review or an audit, with a larger program, say a program who has 700 participants, would they be expected to do an audit on their entire population, or would you accept a sample?
Well, the impact analysis is really going to be very specific to the issue that was discovered during the audit. So in some cases, we would want to gather information for every participant regarding the particular issue. But in some instances, we'd only want to gather specific information for specific participants. So for instance, if we found that if there was an issue regarding participants who were placed in nursing homes, we may ask in that impact analysis, could you please look at the records for any of your participants who are in nursing homes, rather than every single participant. But it really it's going to depend on a case-by-case basis.
Yeah, and I will add that there are times, if we can't limit the scope of noncompliance, as Dan just said, that we would request the PACE organization to do a full review, because we think it's important to understand exactly who was affected by the condition. That being said, we've given PACE organizations the same time frame that we give MA and Part D organizations, 10 business days to complete this review. So we think it's a reasonable amount of time to conduct the impact analysis. If for some reason a PACE organization is struggling in that time frame and they need a few additional days, they should bring that to their audit lead, and the audit lead can discuss it with them on whether it would be reasonable to extend the time frame.
Okay, thank you. My original question was related to what you were saying about this being a learning experience for the audit team and for the PACE organization. So I truly appreciate that. And obviously, as you've shown, there's a lot of learnings still needed around the process for service delivery requests, and the face-to-face assessment and the timing of that, and the timing from when the request is received to the 72 hours. So these seem to be topics that are being discussed a lot. And I don't know if you're willing to discuss that now, or if you're going to be, I know you're going to be issuing guidance, but I'm wondering, as we are trying to standardize the process in anticipation of upcoming audits, when might we expect that guidance?
Oh, well, that last piece, I don't know if I can answer, but I'd be happy to talk about the first piece, because I think we were anticipating getting the question around service delivery timeframes. And we know that there's a lot of confusion right now around when does the time frame start for a service delivery request, and whether or not it starts when a member of the IDT receives the request or the full IDT receives the request. And because we know there's confusion, we don't think it would be fair to hold PACE organizations accountable for one standard or the other right now. So what we're doing is we're going to ask for internal policies and procedures around the receipt of the service request and when your organization deems it received, and we're going to hold PACE organizations accountable to those policies until we can release guidance. Now, as far as guidance goes, our SMEs and central office are aware that PACE organizations would appreciate additional clarification and guidance in this area, and they're working hard to address those issues. So while I can't speak to exactly when guidance would be forthcoming, it is something that our SMEs are aware of.
Okay. So in continuing that discussion, if that's okay, the timing of the receipt of the request also impacts the face-to-face assessment. So if we have a policy that says we receive the request when it comes to the full IDT, then that impacts the fact that somebody may have to go back and do an assessment, even though they did an assessment just yesterday. And that's causing, I think, a lot of angst and maybe a request for, is there any opportunity for some flexibility on that timing of the face-to-face assessment?
Yeah, no, that's understandable. And I think where we come from, for audit purposes, we're looking to make sure that PACE organizations adhere to the regulation, but we're also trying to be reasonable. And a PACE organization can't use a prior assessment when it's a semi-annual assessment, an annual assessment, some other assessment that they conducted. It has to be specific to the service request. That being said, there are instances where the right member of the IDT is actually the person who receives the request. They conduct an in-person assessment in response to that service request, and then they bring it to the full IDT. And as long as the full IDT doesn't decide that there's some other discipline that also needs to conduct an in-person assessment, for audit purposes, we'll accept that in-person assessment as evidence that the regulation was satisfied.
Even though the official time of receipt is the time it comes to IDT?
Yes.
That's correct.
Okay. Is there any kind of timeline around that? So just keeping on pushing on that, if, say, a physical therapist is seeing a participant on a regular basis in the center, not necessarily doing an assessment in this is probably, you're going to say, no, this doesn't count, but not specifically in response to having received that request, but they just saw them, they're seeing them regularly, you're not going to count that?
Yeah, the key part of what Caroline said was in response to the request.
Yeah.
So that is really where I think where we would draw the line for audit purposes.
Okay. All right. Thank you.
Hello, my name is Laura Lyons, and I'm from Life NWPA. I just wanted to have a clarification. When we're talking about service requests and grievances, and it was mentioned the oral and written notification, is it one or the other, or is it both? That's my first question, I guess.
So it depends on whether you're talking about approvals or grievances. Oh, you're talking about grievances. Mm-hmm. Oh, I'm sorry, excuse me. So our regulation does not specify how you have to notify participants how you have to respond to a grievance. What it does say is that the PACE organization has to develop policies and procedures on how you're going to respond and resolve a grievance. And it includes both the response as well as the timeframes for that. Mm-hmm. So for grievances particularly, we'd be looking at your policies and procedures, which is also why when you get attachment 2 with that engagement letter, it's going to ask you some specific questions about how do you respond to grievances. Do you do it orally, in writing, both? And what's the time frame that you have for responding to grievances?
Okay. And maybe I just need to be clear. So when somebody comes to us and puts a grievance in, we do hand written notification that we hear your grievance and we'll be taking care of this and coming back to make a resolution. After we decide what team member is going to focus on this, they meet with the participant, come up with a resolution. So we're just going to follow our policies we do that orally. We don't actually hand them a paper and say, this is your resolution.
So long as your policy states that you respond to the grievance orally, mm-hmm. then we would accept that, yes.
Okay.
The one thing I would say, that I would add to that is we do expect to see some documentation that they did speak with the participant. Yes. It just doesn't have to be a letter. Okay. It can be a note in the progress note.
Yeah, we have in our progress note. And then just one other question, it has nothing to do with that. The state, when they came in, they did our audit this year. So are we anticipating that we'll have this new audit from the CMS in 2018?
Yeah, when you're on a routine schedule, mm-hmm. You're audited every other year currently until the new regulation comes out.
Okay.
So yeah, if you did not have an audit this year in 2017, or if you're not scheduled for an audit in 2017, you can expect an audit in 2018.
Okay. All right. Thank you very much.
Yep.
Good morning. My name is Eileen Coons, and I'm with Onlock in San Francisco. And I first wanted just to say I appreciate CMS's approach about learning through this process and continuing to look at the issues of burden. As an organization that has over 1,400 members and 7 PACE centers across our region, we really look at some of the volume of some of the universes as something that we'd like to continue the dialogue about, what really is the value and is in some cases sampling a more appropriate approach. So we look forward to that and appreciate CMS's work. I did want to clarify one question that came up about personnel and the universe for personnel. I wanted to confirm that obviously we'll include our employees and contract staff who are working at our PACE center as part of our interdisciplinary team. Our interpretation was that we would not include contract providers such as home health agencies and such, and I was a little confused in the earlier discussion because we would not include those on the personnel universe because they would be part of our contract oversight process.
So if you have specific contracted staff who are working directly with employees, what we would expect is that that a PACE organization can demonstrate compliance with the regulatory requirements for staff and contractors. So there are going to be parts of that, I think, that are strictly met through the PACE organization, but there may be parts of it like ongoing competencies. You know, if you work with the contracted agency on their ongoing competencies specifically for your PACE participants, then, you know, it probably involves gathering some documentation to show compliance through both the contracted agency and the PACE organization. But we would expect to see aides and people working directly with participants to meet those requirements.
Yeah, and I think we're really focused on the individuals that are contracted with your organization.
Exactly.
And, right. So, I mean, we're not asking for a list of all contracts that you have, but rather contracted individuals that are
and so like if you're
care.
contracting for a physical therapist who's part of the interdisciplinary team, I would expect that to be the focus of the scope, as opposed to like a subcontracted agency, like a home health agency. So that's, I think, the distinction that I'm trying to make, which I'm hearing we're really talking about the individuals.
Well, I think when you say talking about individuals, I think you're still referring to individuals with the home health agency who would provide direct care to participants. So for instance, if you contract with a home health agency that employs 250 employees, but really only 3 of those employees deal with your PACE participants, then we would be looking particularly at those 3 employees who work with PACE participants.
Okay, thank you. We might need further, I would appreciate some further discussion around that.
Okay, and you know, the PACE Audit Q's mailbox is where we're sort of housing all of those questions.
Thank you.
So if you want to continue the discussion.
And also, we're not in this first round, so it will be interesting to see kind of how the dialogue goes in terms of, and we'll submit a question. Okay. Thank you.
Thank you.
Good morning. My name is Chris Van Reen, and I'm with the National PACE Association. And I think we'll look forward to kind of further clarifying the requirement around kind of staff and employees. And again, I think we've interpreted that to mean kind of individuals who are kind of individually kind of contracted. And in terms of employees of contracted entities, that really we have considerable contract oversight requirements as it applies to those employees of those other entities, and would monitor kind of compliance through those contract oversight. I have a more general question about the PACE Audit Consistency Team. I wonder if you could talk a little bit about who's on that team, a little bit about the role and kind of how that team works vis-a-vis kind of the regional audit teams and team leads, audit team leads, et cetera.
Sure. The PACE Audit Consistency Team is a core group of auditors that have been identified both from central office and the regional offices, and they meet to hear every audit condition with every audit team. But there's a core group of individuals that are made up of central office and regional office people that are responsible for being the pact that the audit teams would then come meet with, and they would discuss the conditions.
Okay, thank you.
Are there any additional questions from our in-house audience? Okay, I'd like to thank our subject matter experts, Caroline, Daniel, Anne Marie, and Lisa, for your discussion on the audit process. Okay, it is now time for our first session evaluation. Please take out your smartphones if you would like to text your response or go to the poll EV link on your smartphone, tablet, or computer. If you would like to evaluate this session, and we highly encourage that you do so, and you are participating by cell phone, please enter A in response to the question, "I would like to evaluate the session," and send your response. You will receive via text the following message: "Hello, please evaluate this session by a link." Next, select the link and you will be taken to the Poll Everywhere site. Choose Start and you will be presented with the evaluation questions one at a time. Select your answer and then click Next to advance each question. Submit your response by choosing Finish. If you are participating via the internet, choose Yes in response to the question, "I would like to evaluate this session." And you will be presented with the link to evaluate the session. The link will appear quickly at the top of the screen in green, and you'll go ahead and click that link. When the next screen appears, choose Start, and you will be presented with the evaluation questions one at a time. Select your answer and click Next to advance to each question. Submit your response by choosing Finish. We will now be taking a break for lunch, and we will promptly begin our next session at 12:45 p.m. For our in-person guests, please visit the cafeteria located downstairs, or you can also get some lunch options at the farmer's market. If you pre-ordered your lunch, you can pick it up at the Jasmine Cafe, which is located right outside of the cafeteria. So please enjoy your lunch, and we'll see you back soon. Thank you.